And so just to expand a little bit on how sort of hormone fluctuations or decrease might manifest. I
Mhm.
think, I mention this often as well. This article I read, you probably are familiar with it. It was a New York Magazine article. It was called Midlife Psychosis. And
Mhm.
I don't remember exactly all the details of the article, but I remember reading it at the time and thinking, I had no idea. As somebody who had had bouts of depression in childhood, teenage years, in my early 20s and so on, I don't think I realized even throughout all of that how impactful hormones were. These women, I don't remember how many were featured, maybe two or three in the article, their lives were upended. Their behaviors radically changed as a result, in part, of their hormonal fluctuations. It was really scary. I mean, I think someone ended up in jail. I'm not sure. It was really intense. So could you talk a little bit about that, sort of not to frighten people, but just so that I think people can wrap their arms around the idea that, if I'm really struggling mentally or emotionally, if I'm really, really having trouble with X, Y, or Z, perhaps this is my hormones and I need to go speak with somebody about that.
I'm glad that you brought up your past history because what I tell my patients and the women that I speak with is that they should know about the three P's, right? If you're going through midlife and you are wondering, okay, is this a major depressive episode or is this related to my hormones? Knowing the three P's can be really important. So, number one is period changes. If you're having period changes, that is not a symptom of major depressive disorder. There's something called the DSM-5. It's a diagnostic statistical manual for psychiatric conditions. It's like the Bible of psychiatry. Under the criteria for major depressive disorder, periods don't show up anywhere in that text. So if you're having period changes, you should be asking your doctor, your provider about perimenopause or menopause. Um, the second is physical changes. Under the diagnostic criteria for major depressive disorder, there are no physical changes. And so if you're having physical changes like hot flashes, dry skin, changes in odor, changes in urination, things like that, those are more likely to be related to hormones, right? And not a major depressive disorder. And lastly, the last P stands for past. So if you have a past history of depression, if you have a past history of trauma, or a past family history of mental health issues, you're more likely to have a recurrence of that in midlife. So you want to be able that you go to your doctor, you talk to your doctor about your past history. And this is tough because a lot of times we know our past history, but we don't know that of our family members. So we may have to go and talk to some of our family members and ask them in a way like, can you please help me? I'm not trying to learn your business, but I
Yeah,
need your help, you know, because
yeah,
people are
yeah,
very guarded, especially some older generations. They don't want to share their business. They don't want their business out in the streets, right?
sure.
So you may have to say it from a different perspective, like, I really need your help. If you could tell me a little bit about what you went through in your past, or if, what grandma went through, that would be very helpful for me. And I won't tell anyone else because, just because, you and I are okay with the talking about things openly doesn't, we can't assume other people are. So learn those things, those three P's, and go to your doctor about that. And I think that's a really nice place to start to try to figure out if which one of the two are happening. But
Absolutely.
one,
I'm
but
sorry.
but in general, women are more likely to have depression than men. Twice as more likely to have depression, twice as more likely to have anxiety. So there may be the component of, again, we talked about those vulnerabilities throughout life because of our hormones that sets us up for more of a vulnerable disposition. But knowing that, right, that knowledge is power, knowing that we can start to plan. That's where the preparation comes into place.